Good morning, Dr. Palermo with this week's Motivational Monday. As many of you know, October is Breast Cancer Awareness Month. I'm sure you're already seeing lots of pink ribbons scattered around the city. The idea is that we want to get awareness on breast cancer, and this is really driven by the companies that do screening, like the radiology groups and the hospitals that do mammograms, and also the companies that make drugs for chemotherapy. It's sort of a win-win. We diagnose breast cancer, and they also make money in diagnosing breast cancer. Now, I'm not completely against doing this, and I do think it's important, so don't get me wrong. But that is secondary prevention. That means it's diagnosing after the disease already has occurred. But what about primary prevention? That, of course, is what we focus on a lot at Thrive. And I'm not saying that primary prevention should take the place of secondary prevention, but it should be something that you consider first and foremost. We know that at least 30% of breast cancers can be prevented with diet and lifestyle. And the more we learn, it's probably a lot higher than that. And so it's a lot more than genetics. It's what you do and don't do. Certainly diet plays a key role. Some of the newest information on the gut microbiome and its relationship to breast cancer with regard to detoxification. There is an enzyme called beta-glucuronidase, which is a big word, but it's actually a compound made from bacteria that we don't like to have a lot of in the gut. When it's high, our body is not able to remove the byproducts of estrogen breakdown. So the estrogen gets recirculated, and that can significantly increase our risk for estrogen-related problems like fibroids and bleeding, and also breast cancer over time. Getting a good, healthy microbiome can make a difference. There's also been recent research, and no one's ever happy when they hear this kind of research, looking at alcohol intake and breast cancer. Recent studies showed that just 3 drinks a week can increase your risk of breast cancer by 15%. That's a lot. And many of us are drinking more than 3 drinks a week. So they didn't look at that in the study because they didn't think it would be very good. So these are things that we need to consider. Diet, lifestyle, habits, not doing things that can be detrimental. This is all really important. There's a lot of things to be covered. In fact, we are going to do a podcast this month specifically talking about primary breast cancer prevention. All of the things you should be doing so that you can take a more empowered and active role in breast cancer prevention. That's all for now. Have a great week.